It's Mari McInerney from Croakey here at the Medical Radiation Sciences Conference in Adelaide, and I'm here with Kelly, one of the key presenters. Kelly, could you introduce yourself, please?
Yeah, sure. My name's Associate Professor Kelly Spuur. I work at Charles Sturt University. I am the Associate Head of School for Medical Radiation Science and Pharmacy and Physics and Nuclear Science. I'm also the Head of Discipline for Medical Radiation Science for our campuses at Wagga and Port Macquarie.
So you're presenting on something that a lot of people have said we must go and watch, your presentation. Can you say what it is and why it's important?
Sure. So what I'm talking about is the new technology cone beam breast CT, and specifically the difference between our traditional mammography imaging, our 2D imaging, and our digital breast tomosynthesis, and cone beam breast CT using, for women who have breast implants.
And how many women are we talking about?
Actually, in Australia, it's around 20,000 women have breast implants put in each year. So that's a fairly big number. Not all of those women will need mammography, but there is a fair number of them that will be in that target age group for breast screen of 50 to 74. So yeah, I worked last week and I actually saw 3 women with breast implants.
And what's been the issue for them?
So for women with breast implants, because the implant is in the breast, it does obscure breast tissue, so it means we don't get to see as much of the breast as we would for a woman who doesn't have breast implants. So we have to use a special technique. There was a fellow radiologist called Dr. Eklund, and he invented the technique some years ago. With digital technology, we call it the implant displace technique. So what we need to do is actually move the implant away from the field of view so we see as much of the breast as we can. We will never see as much as a woman without an implant, but that's the aim of what we do. So that means that instead of 4 images, women will have 8, and that does increase the amount of dose that those women will receive.
So the new procedure, that will change all that, and it has implications more widely.
Absolutely. So cone beam breast CT is an emerging technology. It's already used in the United States and in Europe and some parts of Asia. It is a cone beam CT scanner. The ladies get to lie on a table with an aperture. One breast at a time will be placed in there, and the ladies can do that themselves, so they're self-positioned. There's no touching, and importantly, there's no compression, and we do a 7-second scan of each breast. So very, very different from our normal 2D or DBT mammography that most people would be used to. And that's got huge advantages, both for the women and also for our workflow as well. So very, very new. Hopefully we'll be seeing that technology in Australia this year.
And then rolled out?
That would be lovely to see. It will depend on our private practices and our breast screening services, so the government, how quickly that technology is taken up. But again, the advantage to to women in not having to have their breasts manipulated into position by a radiographer, not having to have that compression, that's going to be a huge advantage for the technology. And also the images are exceptionally good, so they're true 3D images, and that will help the radiologist actually looking at the breast when they're doing their reporting.
And from a patient perspective, because it can be terribly uncomfortable for some women, that would make them not want to screen?
Absolutely. Whether it's just having the breast touched, which some women, don't want to happen, or whether it's that, for some women, compression is incredibly painful, despite our best intentions when we do that compression. So it really will change going and having a breast, image done, for these women with that technology.
Fantastic. Kelly, what are we seeing elsewhere in terms of breast cancer, breast screening? Is this an exciting time?
Absolutely. So I started my career many years ago. I just missed out on learning kind of wet processing, so with X-ray film, but I've been through, the film screen era into computed radiography, and then into full field digital mammography, digital breast tomosynthesis. So for me, it's really rounding off my whole career. It's absolutely amazing technology. The images are wonderful. We're seeing all of the breast instead of as much of the breast as we can, because in our current imaging, we're trying to line up a curvy chest against a straight receptor. So it is a juggling act. We have to pull the breast quite firmly to get it onto the image. So we're not doing that anymore. We're literally lying on a table, and the breast is just in that. In the aperture, and no touching, no compression, and a 7-second scan, like I said. So it's a really big change, and one I think is long overdue for women.
And have some countries moved entirely to that?
No, it's still fairly new technology, but what's happening is that it's the women that are driving it, because women, none of us want compression on our breast for that imaging. So I think that will be in Australia as well, the primary driver for that change.
What will it take for that to happen?
Unfortunately, as always, it's money. So we need people like early adapters actually getting the technology into Australia. And again, I do think women will vote with their feet.